the single factor most consistently related to program impacts across the three sectors of early care is program quality. What do I mean by quality? Structural quality refers to the kinds of things that the state or local community can regulate. Things like teacher education, teacher training or professional development, group size, which is the number of children in a class, ratio, the number of children per teacher in a class. These structural features have been found to set the stage for the second type of quality that we look at, and that is process quality. Process quality refers to the children's experiences in the program, the types of interactions that they have with their teachers. What sorts of emotional support are they receiving? What kinds of instructional support? What are the activities in the program? How well do those activities match children's interests and skills? That's process quality. What we find in literally hundreds of studies is that process quality is related to child developmental outcomes. In one study that I've been involved with now for more than 20 years, we studied the effects of process quality. In this study, funded by the National Institutes of Child Health and Human Development, the part of the National Institutes of Health that focuses on children's health and development, my colleagues and I have followed the development of 1,350 children from middle class as well as low-income children from birth to the end of high school. As part of that study, we observed the children in their child care settings at 6 months, 15 months, 2 years, 3 years, 4.5 years. We then followed and while we were there, we assessed them in terms of structural quality and process quality. We then followed the children into elementary school, where we observed them in first grade, second grade, third grade, fourth grade, fifth grade. Then we followed the children to middle school, and then to high school at age 15, and then again at the end of high school. Among other findings, we found that the quality of early child care was related to standardized reading and math achievement scores prior to kindergarten, and then again in the elementary grades 1 through 5, and then again at age 15. Center-type care was related to achievement scores prior to kindergarten and then at age 15, but not in elementary school. At the end of high school, we found that both quality and type of early care were related to outcomes such as class rank, college admissions, and academic grades. Is early care and education worth the investment? From the classic projects that were initiated in the 60s, 70s, and 80s, we saw short-term benefits on children's academic outcomes and long-term benefits on educational attainment, earnings, health, as well as reductions in crime. In the middle term, there were some mixed findings, with the effects present at some ages and not others, for some outcomes and not others. To date, we see similar pattern of findings in the latest generation of studies. We are seeing consistent reports of short-term impacts and some mixed reports of middle-term outcomes of high-quality programs that mirror the early reports. But we're going to have to wait a bit to see if there are long-term effects of these contemporary studies, because the children have not yet reached those older ages. In the meantime, research tells us the conditions that need to be in place to maximize the likelihood of positive program impacts. Programs must be high quality, and the linchpin of quality are highly skilled teachers who can oversee the activities and curricula that build on and reflect children's skills. We also need to better align early childhood programs and the primary grades so that children can continue to build their skills and not take a step backward. Are these investments in early care and education worth it? Without a doubt.